2024 brings some changes to Medicare Part D that we'd like to share with you today as you prepare to make decisions about your prescription drugs for 2024. First of all, what I'm about to give you is the standard format for Medicare Part D. Keep in mind that the carrier that you select can deviate from this. However, it has to at least meet this minimum requirement. So if you're talking with an agent and your benefits are a little bit different than the ones that I'm sharing with you today, it simply means that you're getting an enhanced benefit. Because in 2024, Medicare Part D has established a deductible of $545 for prescriptions prior to that plan covering anything. After you, the insured, have met a $545 deductible, then your plan will pay 25% of the cost of your medications. And your plan will continue to pay 75% of the cost of those drugs until you have met $5,030 in prescription drug cost. Once that has been done, you will then reach the next phase, which has traditionally been called the coverage gap, or some folks used to call it the donut hole. During the coverage gap phase, the insured will continue to pay 25% of the cost of the drugs. However, in the calculation of things, they will get full credit, 100% credit for the cost of the drug, including copayment towards their out-of-pocket threshold. And whenever the insured has reached $8,000 between their out-of-pocket cost in the initial phase, the 25% they were paying for their medications, and from the point that they've reached the coverage gap, the 100% credit for the cost and copayment on the drug, when they reach $8,000, at that point the insured is finished for the year. They will have 100% coverage. So that will be a change for 2024. It's a change that we're excited about. Now keep in mind that every carrier is required to send you a statement monthly letting you know how much you have spent out of pocket towards those thresholds, and it keeps you from running into the coverage gap without any type of knowledge. This is a safety net. Be sure to read that when you get it in the mail each month. Also, when it comes to Medicare Part D, each carrier can have a different formulary. So not every drug is covered by every company. It's going to be very important that you check your medications to make sure they are covered. Also, when it comes to Medicare Part D, plans will have different guidelines such as step therapy, prior authorization, or quantity limits. It's very important to look that up as you go through your benefit options. Another thing that will be important for you to look at is your pharmacy. Some carriers will have a standard network regardless of which pharmacy you use. Others will have a preferred and a standard network. If you enroll in a plan that has a preferred and standard network, in order for you to get the best cost-saving measures, you will want to be sure that your pharmacy is in the preferred network. So if you have any questions, feel free to ask the agent that you're working with today. But 2024 is an exciting step as we move into Medicare Part D. And even more changes will be coming in 2025. But in 2024, you will see improvements in that once the $8,000 out-of-pocket threshold is reached, all of your medications will be covered at 100%. Again, thank you for your time today, and we wish you the best as you explore your Medicare Part D options.